Hi, I'm Ashley Williams. I'm a licensed physical therapist and I practice at Next Level Physical Therapy and Performance. This video I want to instruct you and educate you a little bit about a few very basic but foundational exercises that are for core and hip, more glute specifically, strengthening. If you have any kind of low back pain or hip pain, these would be very helpful. So the first one I want to show you are called draw-ins. They're also might be called pelvic tilts or transverse abdominis isolated isometric holds. There's lots of names for it, but basically you're going to line your back on a flat, firm surface. And typically, you know, the hard part is to really figure out what muscle this is. It's the deepest layer of your abdominals. Not the six-pack rectus abdominis, so it's the deeper layer. So I always think about kind of pressing my low back into the table or the floor, and I just want to engage that lower abdominal muscle. It's the same muscle you use to laugh and cough, actually. So, but it's like a flattening and like a cinching. I think down with my belly button and slightly up as well. Kind of helps me engage that. So I'm doing a draw-in right now. I don't know if you can really see that, but I'm doing a draw-in and I'm going to just hold this. I should be able to talk and breathe, no problem, but it's challenging. And I'm going to hold for about 10 seconds and then release that, give myself a little 5-second break, and then do that 10 times. So these are called draw-ins. Okay. The next one I want to show you are called bridges. This is more specifically for your glute muscles. Glute maximus more, and a little hamstring. So I'm going to squeeze my glutes now, engage those, and then lift up and kind of squeeze and hold at the top here. I am bridging my hips towards the ceiling. And again, I'm going to hold it for about 10 seconds and do it 10 times. Just be very slow and controlled on the way up and down. Now, if you don't have that kind of range of motion, no worries. You can just go up to here. That's fine. As long as your glutes are engaged, it's good. It's a good exercise. And of course, no pain in your back or hips. Okay, the next one I'm going to do are called clamps, sideline clamps. So this is my starting position. Knees are stacked, pelvis is stacked. I'm going to keep my hand here so I don't move my pelvis, and I'm just going to lift this knee up towards the ceiling. I'm engaging this muscle right here. It's like a side glute muscle, piriformis more specifically. Just like that. Slow on the way up, slow on the way down. And again, you can hold it for 10 seconds and do it 10 times. Or or you can add an ankle weight on your thigh, or a rubber band, a TheraBand around your knees, around your thighs, to give you that resistance. But that's enough. And then the second way clams, you're going to internally rotate your hips now like this. So it's a little bit different. So there's kind of two ways to do these clams. So one, the knee comes up. The second one, the ankle comes up. It's still side kind of glute muscles there. And then the last one, you do need a pillow or a little ball or something to squeeze. But you put it between your knees like that, about hip distance apart, and then you just squeeze. You're squeezing and holding for 10 seconds. It's inner thighs. You should feel it right in the inner thighs there. All right, 10 seconds, 10 times. And that's it. There's about 4 or 5 exercises that are really good and really helpful for any kind of back or hip pain. So try them out.